Thank you, Dr. Paul Anderson, naturopathic doctor who has been basically, we call him the OG. He has been our mentor, helping us learn all the latest research and has also so much experience. And so I really wanted him on today because even in the natural medicine world, there are lots of debates. We are just not as experienced, in my opinion, as he is clinically, and then also looking and reading the research. So I want him to come on today to answer many of your questions, and even questions that I've had as a clinician. After 13 years, there are still things that I don't have experience with in terms of infections that I wasn't even around for, that you have more experience with. So I'm not saying you're old. I'm just saying you're older and you're more experienced. But I do want to start off with vitamin C, specifically IV use. And I know in China they were using it, and now there are US hospitals that are using it. So can you please just comment for the layperson, why are we using IV vitamin C? What does it do? What are the dosages? What's important for us to know in the hospital setting first?
Certainly, and thank you. So yeah, just for background, my first jobs in medicine were in laboratories in the 70s. So I've been around a while, and later I decided that was boring, so I became a naturopathic doctor, and I've never been bored since. So been around doing this a long time. I think the best way to simplify this, because it's so people get really, even other physicians, because I'm talking to them every 5 minutes now. um, it's confusing because vitamin C doesn't act pharmacologically like a lot of drugs do. There are certain drugs that act like it, but not very many. So we don't need to get into that really at super depth, but that's part of why, if you're in a hospital setting, an intravenous administration is probably better. And so there's a couple things to keep in mind. In China mostly, and then now in somewhere between 6 and 10 that I know of, so there could be more, hospitals in US, and certainly in other countries as well, there are continuous IV drips going on with people who are in either intensive care or hospitalized under quarantine with COVID-19. And prior to COVID, they were doing different studies on hospitalized septic patients, which is another where your chemistry gets so far off that you can die from that. So in China, what triggered it was they already had one of the doctors on their expert group, which is a very large group of doctors in different hospitals that came together, was using it for sepsis and a few other things. And the important thing I think to remember is, the first thing, he got it included in the protocols. The rest of their protocols are exactly the same. They're using the same drugs if you go into certain categories of crisis. They're using the same other hospital procedures for your respiratory system, et cetera. They just added vitamin C in. And the way that they did it is what confuses people if they've had an IV of vitamin C. It's very different from what you might have got in a clinic, an outpatient setting.
Right.
In the hospital, they're giving somewhere on average between 100 and 200 milligrams per kilogram of body weight, but continuously 24 hours a day, 7 days a week. So what most hospitals are doing is dividing that into a 12-hour IV of half the dose and a 12-hour IV of the other half, just so the nursing staff can catch up. And in the Chinese data, which is, so one of the questions people will have is, do you know anything, not about sepsis or not about some of the other things we've looked at, but do you know anything about COVID-19? And the Chinese are the only people with any data up to this point, and they're putting out early versions of the data, and of course we have to wait for a lot of it. But the thing that got my attention was, with this dosing strategy between 1 and 200 milligrams per kilogram, 24 hours, 7 days a week, um, out of about 350 hospitalized patients, they took 50, and there wasn't information about how they picked them or anything. I believe they were sicker, but that's based on an interview with the doctor who did it. They took about 50 of 350, 360 COVID positive patients who were in hospital, mostly ICU, and put them on either 100 if they were not needing mechanical ventilation, et cetera, or 200 milligrams per kilogram if they were sicker, et cetera. And of the 50, they noticed two, I think, critical things. One is nobody died in the group of 50. We don't have death rates on the other, let's say 300 and some patients, but we know that there were fatalities in ICU from that group. So the 50 that were getting the IVC didn't die. That was the first thing. The second thing was that their average length of stay in the ICU or in hospital total was 3 to 5 days shorter. And this matches some data that I just reposted from Journal of Critical Care, not on COVID, but on mechanical ventilation and how vitamin C shortened the time frame. So it matches what's going on elsewhere. The most important thing I think that they thankfully shared this information was there's really not a downside on the safety side. We can talk about that. So it's very safe. It's easy to do. It's not having interactions with any of the other ICU drugs. All good questions that any ICU person is going to ask you. But the other thing is, if you extrapolate the number of hospital beds to, I've got 3 to 4, maybe 5 days less hospital bed time times how many people I've got in my ICU, that buys you a lot more, not just cost, but also bedtime for another patient. And I know in North America, that's our concern, is we might run out of hospital beds, especially ICU beds. So I think that on the order of dosing and strategy, and I want to talk about why the hospital dose might be very different from outside of hospital, both pharmacologically, but also just from why would it help somebody, not go into respiratory failure, et cetera. But I think from the point of view of just resource management, it's rather inexpensive to do it this way. And if you save, even if you save 2 days on a hospital stay in an ICU, that's a huge amount of dollars. It's also a huge amount of days of hospital beds you could give to other people. So I think that it's the benefit in the hospital setting is the ability to give it continuously, and what that's doing underneath for for the biology that would otherwise take you into, say, respiratory failure or respiratory edema, et cetera. So we can go any direction you want from there, but that's kind of the Cliff Note version of the
Question
hospital
I
use.
had on the live was, we know when you take vitamin C, it's an antioxidant, typically orally when we take it 1 gram, 2 grams, 3 grams a day, let's say. And we know in cancer, when we say high dose IV vitamin C, like 50 grams a day, that's more creating an oxidative stress. In this case, what are we doing when we're giving it sort of continuously all day?
Yeah, and that's another thing that's kind of come up as a confusion. So probably want to talk about it right at the beginning. Most of the reports and some of the publications, even prior to this, you have to be a little careful when they say high dose or low dose, because typically the doses used in the high dose studies are actually not high dose. What they mean is, there's a reason for it. What they mean is it's high dose compared to what you eat every day or take in of normal oral vitamin C. So certainly it's more than that. And we know that the pharmacology of vitamin C from what you eat, or maybe lower doses of oral use of vitamin C, they're mostly going to be supportive to antioxidant systems. The other thing is that what they're calling high dose is just a little bit above that in the 24/7 continuous infusions, but it's higher than you would ever eat or take in. And there's a reason why that's probably medically helpful. That doesn't really get to an oxidative dose either. Usually you're looking at real high doses for oxidation. And here's the thing that uh, to give the quickest version of why these, let's call them very high doses that you would get as an outpatient, say in cancer or bad viral infection or something. Why would they do something different? It's because the body, there are very few drugs that don't undergo linear elimination kinetics. That's very important to know. And so and vitamin C is not one of those. So if you put a lot of a drug in, you eliminate at the same rate as you would if you had a little drug. Vitamin C and things like phenytoin and other drugs, there's a small group of them that are zero order, meaning as soon as if you put them in IV, you max out the elimination, so an IV stays in you longer. Now, the very high dose strategies at say 25, 50, 7,500 grams of vitamin C, they do oxidation for a time period, and that may be good for certain things. But because they can't eliminate, they have this long, slow elimination that goes out. During that time, you're actually then supporting antioxidation, but at two different time periods. So with our outpatient use, where we might give somebody, say, 50 grams, but over 2 or 3 hours, you're getting both. Inpatient, these people, unless there's one time over in China when they're doing higher doses like 50 plus, we'll talk about that later, but for the average inpatient, if they can kind of stay in that medium range between superoxidation and and deficiency, let's say, what happens is their uh, oxidation antioxidation balance can be returned to normal or helped. And that's what gets you in trouble when you're critically ill in the hospital. It's not that oxidation is bad. If we don't have oxidation, we don't have any immune response. So that's not good. It's when oxidation can't be modulated. The sicker you get, and this has been looked at in some of the studies with sepsis, for example, the sicker you get, the lower your antioxidant status goes because you're trying to fight the illness. If you get to a certain point where your antioxidants are just not there or not working as they ought to, the pro-oxidative things that say a virus would cause or sepsis would cause, et cetera, are not controlled. They're out of check. So the theory originally was, well, if we keep this level going into vitamin C and just kind of keep it in there all day long every day, at least we will back up the redox system so that we keep these guys balanced. We get a little bit of plus, a little minus, but it never goes away. Well, it turns out in something like, say, COVID, or in the case of H1N1 flu or H5N1 flu, especially, what normally takes your life would be respiratory failure. Okay, well, that's kind of ground zero for the oxidation antioxidation balance problem, because once you run out there, you get inflammation, and you can't breathe, you can't move air through fluid. Okay, so I think what people, and this is in my estimation, we can talk about my research background, but in my estimation, when they were coming up with, in North America anyway, it's been done in other countries, but when they were coming up with hospital protocols for sepsis, or maybe now, in China, COVID, et cetera, what they're really looking at is the biology of ascorbic acid vitamin C family there. Ascorbic acid is kind of the isolate part, but that's what we give IV. If you look at the antioxidant system in your body, it's more than one thing. And so if you look at what keeps most of the cell components antioxidized and what keeps the cell membranes antioxidized, those are two things that we don't wear out as much. Either we can make them in our body with appropriate things, or they don't require a lot. They're not water soluble on one end. Vitamin C sits in the middle and can help everybody stay balanced. Vitamin C we don't make in the human body. It's water soluble. So if I don't get any today, I am going to get lower. The other thing that they see, especially, and they've looked at this actually very critically in septic patients, is the levels in the body go down the sicker you get of vitamin C, because we don't make our own, we're not taking it, it's going to go away. The other things go down more slowly because either they're fat soluble and they stay in the body, or we make them ourselves. So the thought was, well, vitamin C is critical. It has to be put into humans. the sicker the person is, the lower the levels get, lower levels get, this antioxidant balance goes out the window, and then we have all these problems.
Mhm.
So if you think about it, if you have some, they're not going anywhere anyway, they're in a hospital bed. If you have somebody and you're giving them what we might consider in an outpatient setting a low dose, but it's 24/7, it's not really a low dose, you never run out. And that's the theory behind that, because it's something that's critical to the human. The other thing that they look at, and I think when we get past the pandemic and we can look retrospectively at data, which is usually a little nicer. Right now we're in the middle of it and we're making decisions based on this probably is a good thing to try and it's safe. Um, I think what we're going to see is the people who get sicker faster probably were fighting other things.
Mhm.
So they're depleting the water soluble nutrients as well, especially vitamin C. So then they get hit with a big virus and it just takes them down very, very quickly. And in the expert panel summary, which is quite long, that I got in Mandarin from the hospital over there, and then we translated it to English because I'm not good with Mandarin. Got it translated. One of the other things that they said that was very critical in their findings, they had an entire paragraph on it, were the sicker you were with other infections that you might not have a lot of symptoms from before you got COVID-19, the quicker you would get into ICU or need mechanical ventilation. And I think that that will hold up as a problem. So it's like you got all these things sucking away at the vitamin C that we don't make inside ourselves. It makes sense if it's that important in balancing our oxidation, antioxidation. We just put some in every day to the person. So that's kind of the background there, I think, with the hospital use.
What comes to me is I've had patients who have actually wanted to get tested, and because of the shortage in the ICU beds, they haven't. They've had all the classic symptoms, even family members from Europe visiting them, and cough, fever, but
Mm-hmm.
they're young, they're not 70, they're not
Mm-hmm.
immunocompromised, and they can still breathe. So they've been told that,
Right.
it's not necessary. So for those people who may have COVID-19, may get COVID-19 in the either recovery phase or in the preventative phase, what about us? Like, what about all the people who aren't in the hospital? What are we supposed to do? Or what's your comment on that?
Right. Um, that's so the next interview I'm doing today is all about that part. So I'll shorten that up a little bit. And I do think so. People, one of the reasonable criticisms, I guess, that as I posted some of the Chinese information as well, if we don't do it in North America, we don't believe anything anyone's saying. But I do think it's valid to look at the expert. It's a large expert. It's over 50 doctors who are all agreeing that this is what we should do in China. One of the things that came out of that also, if it's a lot of reading, but you can find it, is they really were focusing on a couple of things to keep people out of the hospital because they obviously were maxed out. They prevention to them was huge.
Mhm.
And it's not prevention, they might have disease, but if we can keep you out of the hospital with disease and healthier, not needing ventilation, not having respiratory problems, that's worth, that's gold to us, right? And it's going to be the same in North America or anywhere else. And so the things that they focused on actually were preventive strategies. And one of the preventive strategies was the oral use of vitamin C throughout the day, every day, for the same reason, because we probably aren't eating enough. And if we're battling a virus, the longer we keep our antioxidant, pro-oxidant stuff balanced, the more we stay out of hospitals. So that was one huge thing they did. And what essentially they were trying was what Dr. Robert Cathcart published in 1981, which was continuous, not continuous, but broken up dosing through the day. Because most of us have tried vitamin C, take too much, you get loose bowels, and that's very uncomfortable and things. It's not harmful, but no one likes that. So Dr. Cathcart, way back in '81, and he was someone that was actually a mentor to me. He's passed away now, but in we'll call it the olden days, he published this, and what he did and what we were all doing was at least 3 or 4 times a day you take a dose, so it's spread out. And what we notice is in a healthy person, their bowel tolerance is quite low. They really don't need much. And there's some research that shows, well, this makes some sense because we don't, we don't need that much every day. But the other side of it is in sick people or people getting sick, they'll tolerate real high doses while they're either fighting or actively in the middle of an illness. So in China and in a lot of recommendations in other parts of the country, and certainly here with my family, what I'm doing is just that. And so for, might be hard to tell on a video, but I'm not a small size adult, and so my body weight dose is a little higher. I use ascorbic acid powder because that's easy and I tolerate it really well. I just put it in my water and I drink it through the day. I know that for many reasons, like in our clinic and in other areas, and I've done some house calls and things with really sick folks. I've been exposed a lot. I did test negative, so that was good. But I've been fighting a lot of stuff off, and so I'm tolerating, 3-4 grams 4 or 5 times a day with no digestive trouble. So I know my body's using a lot. What I would always tell patients is as soon as it stops being tolerated, back off. You don't need it that much. Now, I never have somebody start there. I always say start with something easy, 500 milligrams each meal or something, test dose. Next day, if that's fine, go to 1,000, And a lot of times if it's preventive, you don't need as much, but it's surprising how much you can use
Right.
just in cold and flu season, let alone a pandemic.
And I just want to rephrase, we're not saying that taking vitamin C, because we're using the word preventative, that it does not mean that you're not going to get it. The only
Right.
way is for you not to be physically in contact with it, breathe it, touch it.
Right. Yeah.
But this is what he was saying is in China, they were trying to say, how can we keep people out of the hospital, right? How can we make it so that if they get it, they don't end up in an ICU bed?
Right.
And I think there is Cochrane reviews on 39 articles that show, even with the influenza, just a low dose vitamin C consistently every day is very helpful. So this isn't something, I have a lot of doctors who aren't experts in natural medicine, nutraceuticals, and this just isn't something they learn in medical school. And they say, no, you're wasting money, just eat well. And of course, those are all foundations.
Sure. Yeah.
Sometimes we need extra. We're not getting enough. I mean, the cherries are very high in vitamin C, but they're not in season here and they're not organic. And so we just don't get them. I was at the store trying to get some food, and it's amazing. All the aisles with all the boxes, they're all empty, but no one is going in the vegetable section. And we keep telling everyone, we need vegetables, but it's scary because it's alive. And I think people are afraid to touch the broccoli or the kale, but it's safer to go for the boxes and keep it in case there's a lockdown.
Yeah, you can't separate. Obviously, you need the dietary sources, and you need your diet to be reasonably supportive to all of your health, or the other supplemental things just kind of, they do what they can. But I think that, yes, it's very important that people understand this is not like some nutrients where they may have a time in your body where they stay for a while. For example, if you eat, which you get from food, the vitamin E family, tocopherols and tocotrienols and things, those go into the fatty membranes to stabilize them, but they're fat soluble, so they stick around a long time. Same with some of the vitamin A forms or D forms, etc. Vitamin C is not only water soluble, but we don't make any, and we hold on to tiny amounts in a couple areas, but we don't keep it. So like you said, even in the influenza studies, taking low doses but continuously, yes, we're not saying this prevents the disease or anything. The interesting thing I think that we'll see, and it may come first from the Chinese data, is of people who tested positive but didn't need the hospital, who went on continuous oral vitamin C, what was their rate of needing to go to the hospital versus somebody else. I think it's going to be very interesting, but they're essentially, if you read the expert advice, keep in mind it's China, so they have two focus. One is vitamin C, the other is actually traditional Chinese medicine, and they call that out, and they say traditional Chinese medicine, which of course is from China, and so they have a lot of it there, is like what you and I do. It's based on the person and their constitution and all that stuff, but it's very systematized over there, and it's very easy to get. And what they're saying is that will keep you from the hospital and also recovering when you leave the hospital, because you don't leave the hospital healthy. Okay, you leave the hospital able to breathe. That's what gets you out of the hospital, right? And so they're looking and saying things that are easy to access, like vitamin C and traditional Chinese medicine, for example, will maybe keep you out. And so focus on that. And once you're done, will help you heal up. And I think that's the important thing. So it's not really a matter of will this keep COVID away from me or whatever. It's, can I weather the disease better and not need the hospital? And like you said, with people that have, had probably positive members, can't get them tested. I'm in Seattle, Washington, where our US cases started. And we've had unfortunately, a lot of deaths of elders and things of that nature. It's still quite hard to get people tested here too. And so if you don't need respiratory help, even if you go to the ER, you might not get tested in most places right now. So there's probably a lot of positive folks who are symptomatic, but they don't need the hospital. That's great. Last place you want to go is the hospital till you need it. Okay.
Yeah.
But for not really even preventing disease, but preventing the severity of disease, things like vitamin C can be helpful.
In the elderly, we know they have low antioxidant levels, correct, compared
Mm-hmm.
to us. And that could be
Yeah,
one theory, that they're not going to have enough zinc and vitamin D and
sure.
vitamin A and E and vitamin C. I mean,
Yeah,
I wish the World Health Organization would say, other than hand washing, other than physical
right.
distancing, there are other things that you can do to make sure your immune system is strong enough, because most likely many of us are going to get this, and who knows, many other viruses during the winter
Mm,
months. And this isn't
yeah,
going away, correct? I'm hearing that, yeah, these peak in October again, so it's probably going to have
yeah.
another peak. It may mutate again, and who knows? I mean, this isn't new. I'm sure you've been around and seen these things come and go. And so
Mm-hmm.
as an ND, what we are trained to do is really help the terrain, help your immune system so that it can fight it. And
Mm-hmm.
let's say you do get some lung issues after, some fibrosis. What do we do after? What do we do to recover and make
Yeah.
sure that the damage isn't done? And that's where I think this excels, our medicine excels, because there is
Mm.
no drug to take
Right. Yeah.
afterwards to help the fibrosis of the lungs, right?
Yeah.
I know NAC comes to mind, but what are other things that you would suggest?
Yeah. So there's a couple of really important things for that, either before you go or after you come out of the hospital. Just because you just brought it up, with respect to the fibrosis levels, if you look at, we don't have COVID-19 research for that, but we do have H5N1 and H1N1 research on lung fibrosis. And the thing that you see is when you leave the hospital, so that's this year right here, and then you're going forward. Sorry if you're listening without video, but the time after you leave the hospital is the highest for your lung fibrosis. And actually, you have some remodeling over time. So when they've looked at H5N1 patients and some H1N1 patients, and they measure lung fibrosis, it's the worst right after you leave the hospital for a number of months. When they measure them 5 years later, there's actually quite a lot of improvement. I forget the magnitude, but it's not a small. It's not like going from 70% to 60. It's it's a multifold difference.
Mhm.
So naturally, your lungs remodel, but that doesn't mean we shouldn't help them. Okay, if you look at the mechanism of fibrosis that starts, it's related to the mechanisms that cause the pulmonary edema and all of the complications that create trouble with oxygen CO2 movement. It's just those are the acute ones. And if they get acute enough, you pass away and you're dead. If they don't get that acute and you make it out of the hospital, the baseline inflammatory process that was giving you all the edema now is being dealt with by, the lungs are extremely sensitive tissue. Now they're dealing with, essentially there was a war going on there, a chemical war with your immune system and all these things. So if you think about that, it kind of goes back to keeping the antioxidant balance is super important. And it's more than just vitamin C, but that's where we started. And then you mentioned N-acetylcysteine, which is actually used in hospitals to thin mucus secretions when you're in the hospital anyway. N-acetylcysteine is a form of an amino acid cysteine that has a bunch of positive effects. So one is that we would use it, say, in a hospital, well, they use it for Tylenol overdoses, which is the most common drug overdose in the world. But they also use it for when you're on a respirator and you can't move the mucus, it will thin the mucus. The drug name in the U.S. is Mucomyst, NAC. So there's that. That's helpful acutely, but it also supports glutathione, which is one of the other antioxidants that helps to balance a lot of cell activities. And that's not been a big focus until recently, like in a lot of neurological research. It's used now a lot by psychiatrists and neurologists for brain stuff. But if you look back and say, well, why would it help with antioxidants? It's because it goes and it supports glutathione, which is a cohort of vitamin C and some of these other things that are going on. So NAC is very helpful. The other thing I think that we'll be curious to look at when we can see it later on in history is, did the people who got IV vitamin C while they're in ICU, we know that they're in there a shorter amount of time, did they have less fibrosis afterwards? And I bet the answer would be yes, because those are related. So antioxidant balance. Another thing I think that people, it's logical, but they sort of miss this one part that's super simple, and that is a lot of these water soluble things like zinc and other trace elements and vitamin C and even the B vitamins, etc. They do multiple things. So we talk about, vitamin C in a particular area. We talk about zinc. The CDC is now really big on getting zinc in the cells to block viral replication with ionophores like chloroquine and hydroxychloroquine, stuff like that. So that's great. But zinc and vitamin C are part of your first responder system too. So way before the virus gets to you, if it's cold and flu season, you are burning up, you might feel great. You're burning up zinc, vitamin C, and other water soluble things because your primary defense cells that may not even care who the bug is, that just try and kill it or do whatever, a lot of them use a lot of zinc to do this business. So one of the reasons people get sicker often during cold and flu season when they get hit with a big, pathogenic bug like, say, COVID-19, et cetera, is they've been fighting not knowing they're fighting. They're depleting their levels. And if they start out low, like someone with a poor diet or an elderly person or chronically ill person, they deplete, and suddenly, boom, it's like they get the worst sickness ever. So there's multiple layers our body uses for these things. It's the same on the prevention side, like preventing fibrosis, recovery. Now, the other thing I find interesting, and this relates to, because people say, well, okay, it's China and they use traditional Chinese medicine, but that's, it's hard to find elsewhere or whatever. So let me just expand on that. They're saying, they don't have long-term studies, but they're saying that what they're recommending people when they leave the hospital do is keep taking some oral vitamin C, but also do traditional Chinese medicine to rebalance their system. And that could be looked at nutritionally or as a whole person, or however you want to look at it. But here's something I think that's important. I have colleagues in South Korea where they're doing better statistically with all this, largely because their testing platforms were already ready for it. But it's South Korea and in places like India and Pakistan and other places. And what we find is, if I talk to the Korean doctors or people in India or other places, people who are using the kind of the indigenous therapies that are from that area are all having the same benefits that, say, Chinese medicine in China is doing. And so my thought from that is it's more about taking the whole person look, because most of those Ayurveda, traditional Korean medicine, as they call it, traditional Chinese medicine, traditional, North American botanical and naturopathic medicine, and other things that kind of grew as holistic. Let's look at your whole body and keep it going. They all seem to improve after as well. So they seem to help people stay out of the hospital even with positive disease, but B, they help people with the healing on the other end. And so I think people, they'll say, well, I don't have access to traditional Chinese medicine. You may have access to other things that are holistic in that nature. And I think that's really important.
Yeah, and just for those listeners who have no idea what we do, I do want to just quickly say naturopathic doctors are probably the only, I think, healthcare providers in the world that are trained in pharmaceutical medicine and botanical medicine.
Mm-hmm.
Obviously, we have to, because there's a lot of drug herb interaction. So if we do mention something today, please don't just go off. And even zinc, zinc you can really hurt your stomach if you're sensitive to it and you take it on an empty stomach. But zinc over long term can also deplete copper. So please, check in with your practitioner. But this brings up that every single fall and winter, most of us NDs really focus on the immune system and the lungs. I mean, I have a fall detox that I do where I'm strengthening the lungs. I go on zinc. I up my kids D and C and A, short-term A. And this is just something that we do just to help the immune system, and I think right now I am taking zinc and copper, selenium short-term, all these antioxidants. So can you just touch on other things other than vitamin C that can be helpful for people to ask their doctor to at least check and make sure they're optimal?
Yeah, I think, and I think that's very critical, just to keep repeating that. Number one, with a lot of these things, we really want to seek the advice of a healthcare practitioner who's trained in them. And what I always tell people is this is not a slam on a primary care doctor, but most primary care doctors, that's not their thing because they're doing other stuff. So if you're going to look into botanical medicines or nutrient medicines, go to someone who's trained to do it. If you're going to do traditional Chinese medicine, please get a good practitioner of that, right? So, but the other thing is, as you said, cold and flu season, and I kind of do the same thing. It's like that's the time to prevent. So maybe for a short period, a few months, you take more than you normally would. So there's things on the list of things I'm doing and my family are doing that we don't do high doses of all year long. But when there's a bunch of junk around we're trying to prevent, we do. And so we've talked about vitamin C and NAC. Those are actually the first two. What I like about those two also is if you had to prioritize, they're inexpensive. Um, they're very broadly effective, so they cover a lot of bases, and they're just helpful, generally speaking.
And safe.
Then you
Safety is important
and
too.
they're very safe because they are water soluble. So the worst that would happen is you'd eliminate them, and you'd know you took too much. Um, Vitamin A and D and K are fat soluble along with vitamin E, but during the time where your body is fighting, their levels can get hit pretty hard. So vitamin A is one where you do what I do is tend to take some during the more assaultive seasons of the year, and then not the rest of the year because I'm getting it in my diet, etc. But when you are trying to either minimize viral effect, and this is any virus, it's not just COVID, but especially things that affect the respiratory system, vitamin A becomes used a lot. So even though it's fat soluble, it stays in your system, you can wear its levels down. Vitamin A, there's two ways to get it. Mostly in the diet, we get it from carotenoids, from like beta carotene and the other keratin, and that's fine, but it takes your body a lot of work to convert them to fat soluble vitamin A. So for supplementing during cold and flu season, we usually use the fat soluble vitamin A. And again, 2-3 months, 4 months is fine if you're, especially you're exposed a lot. Certainly 1 month. But here's the thing that with vitamin A, it's very important. It's vitamin A is one of those things when you convert it to real fat soluble vitamin A, whether you ate it as a carotene or you ate it as a vitamin A fat, it only has 3 tissues that it goes to.
Mhm.
And it has receptors and transporters, so it only goes to those tissues. But one of the tissue categories is quite large. It's called epithelium, which of course is your skin, and so it's used by dermatologists. But we forget the respiratory epithelium is where this war goes on that can take us out with certain influenzas and COVIDs, et cetera. So vitamin A becomes critically important in respiratory problems. And the respiratory epithelium, if you look at what vitamin A does, it goes right to the nucleus of the epithelial cell and helps to keep it doing the right things. It's a signal molecule. So vitamin A becomes important. Again, seek the help of someone who knows dosing and things for that. Vitamin D, again, there's sort of 2 ways to look at it. If you take it all year long because you've been checked and you're low, or maybe you're trying to prevent something, you may not need a whole lot more if you're always taking it. But during cold and flu season, a lot of people don't take it, and maybe their levels are normally okay. Vitamin D will dip down during assaults, and so it's one you want to look at. The vitamin D that I take personally in my family is also the kind that we use with our sicker patients, and it's a vitamin D with a little vitamin K2 in it because they help balance each other out. Either way is fine, but a lot of people will see, well, why would there be a little vitamin K2? It's because they work together. We mentioned zinc.
Mhm.
Probably of all the trace elements, so things like zinc and copper and chromium and selenium and all that, zinc is most used during cold and flu season because your white cells burn it up and they use it to fight. Other immune things use it. As you mentioned earlier, if you take too much zinc long term, your copper levels will drop, which almost everyone knows. But short term, that's not the issue. You're going to use a lot of zinc. So what I tend to do and what our family does is we take zinc separately and then we take a trace mineral complex. So it's got selenium and chromium and all the other guys to, just to back that up. And then there's a lot. It's social media. uh, Many of the pandemic things, social media wasn't quite as big of a deal, at least in my memory. And so now it's like everything's become famous. There's a lot of herbs people had never heard of that everyone's talking about and all that. So there's a whole lot of botanical herbal medicines that are very good for immune support, et cetera. One of them, just because I have contact with a lot of Ayurvedic practitioners and people who are very, very good at that. Something that we don't think of in Western botanicals as often. I don't say we don't think about it, but they use a lot of neem, Neem, and neem is actually extremely good on the preventive and the recovery end. And actually, if you're quite sick, it's not that bad either. But neem is part of a lot of Ayurvedic formulas. It's part of some Western, I guess we call us Western botanical formulas. The real famous one though is elderberry or sambucus, and that one has a lot of interesting misinformation about it that's going around. So I don't know if you've seen that or not.
Let me ask you a couple of things. So just to back up with zinc, you did mention this briefly with the hydroxychloroquine, Plaquenil, that is being used. And I think our president even said, this with azithromycin and zinc, people are running around now wanting to take this preventative, which I'm
Right.
quite
Yeah.
sure is a good idea. Plaquenil has a lot of side effects, so
Yeah.
it's not just like taking an antibiotic. But it's interesting
Right.
that you said the CDC has it even on their site, that one of the mechanisms could be that it's helping zinc get into the cell and
Right.
that stopping the viral replication. So
Yeah.
I had 3 patients this morning. I often test red blood cell zinc, and it's amazing how many people
Hmm.
actually are either right at the low end or below. So I
Hmm.
do think that zinc is absolutely important. And it's funny that that herb also, interestingly, many drugs come from plants. And the other
Yes.
thing is people going and buying this cinchona bark and taking that preventatively, which again, I'm sure you and I both agree is not a good idea. It has other constituents that can even be harmful for the heart. So don't do that. But talking about elderberries, yes,
Hmm.
I remember I did a post in January, sort of thinking this is very similar. You know, at the beginning, I was like, everyone's over exaggerating. This is just another virus. And then I realized I was wrong. The death rates for this is pretty high. We
Hmm.
think we also are not testing everyone, so it's a bit
Right.
hard to know.
Yeah.
But I did mention elderberries, I mentioned echinacea, and then I had my medical doctor colleague sending me all these articles on, not all these articles, a few, showing that this increases IL-6. These are the cytokines that can cause inflammation. And we do want
Yeah.
inflammation in this, but we also want it to go down and shut down.
Right.
Those are the T regulatory cells, we call them. In this case, there's this thing called a cytokine storm that can cause
Hmm.
death, where the immune system just overreacts, right?
Hmm.
And these things called IL-6, IL-1 beta, TNF alpha, all these things can go up, and elderberry has had some research showing in vitro studies or in human studies with influenza, all positive that it's beautiful, this plant. But
Right.
because of some of this research,
Yeah.
there's a lot of controversy around its use
Right.
and that we shouldn't be using it. So you're the expert in this, and tell me what you think.
Yeah, I think so it's and this is one of those things when you get to the world of immunology, especially immunology research, um, if you're not an immunologist or it's not been something you've been actively reading a lot, there's one perspective that's easy to miss. It's real easy to miss. Um, and that is amplitude. And so a colleague of mine in the research world, Dr. Heather Zwicky, is an immunologist and not a naturopath or an MD, but has studied these things very much in depth and actually has now an article and some other things to kind of go through what I'm about to say. But I'll give the Cliff Note version. Um, and she's I think she and I are competing for like most podcasts to be on
I have an
in
interview with her next
yeah,
week.
yeah. So I'm sure she'll get even more into this. She and I were on a panel yesterday or the day before.
Yeah,
It was a lot of fun. But I love Heather. But anyway, here's the thing: the all of these things, whether it's interleukin 6 or TNFs or whatever, they're so back when we talked about you have pro and antioxidants. What that really means is there's a lot of chemicals like interleukins, tumor necrosis factor, all these other things with initials. The inflammation is mediated by this family of things, cytokines, chemokines, those sort of things. And we have names for all of them because we keep discovering more. When I first studied immunology, we some of them we only had one, and some we didn't even know about, right? So then you get people, let's say from my generation, who that was their last immunology. They look at a paper very reasonably, and it says Sambucus elevates IL-6. Okay, well then IL-6 kills people. We don't want to do that. Well, the gap is rather large, and if you actually go, and I've actually done this for things like probably Andrographis, Sambucus, um, uh, ooh, there's another famous one. Anyway, for a number of herbal things, and you look at actual quantitative numbers of how much IL-6 does this raise, okay? And then you go to, and you're not going to find a lot of COVID studies, but you can find H5N1 studies, probably the closest as far as biological cytokine storm death, right? And you can look at what did that virus do in numerical values with IL-6, for example. What did the herb do with it? And there's two things that people miss that are super critical. One is the herb will be somewhere around maximum 10% of what the virus can do down to a tenth of a percent. So 10% down to less than 1%, depending on the study. 100% with the virus, if you're looking numbers to numbers, and this is actual the same units too. Okay. The other thing though is, let's say you're even taking some Sambucus 3 times a day. The IL-6 bump you get that's insignificant is there and gone. And here's the other part, which Heather will get way into with you, that's super cool and negates all those other arguments, is the herbal response is a bit like a sine wave. So you get a bump up and then you get a physical response by the body back. If you have a virus, the virus is replicating and triggering all these ILs and all these other guys, but like IL-6, it's not part of a physical response. It's part of keeping the viral replication going in your body, and your body not knowing what to do with it. So it's got this giant amount of interleukin-6 and other stuff. It doesn't take a break, okay, till the virus is minimized in your body and you have some antibodies. It's kicking out these high levels, again, 10 to 100 times or more what Sambucus would do, 24/7, right? So you're not getting this little cool sine wave thing where the body has a response and then you take a dose later and it has another little bit of a response. You're getting it constantly. So the virus kills you through very different means. And yes, IL-6 is blamed in both, but it's not even analogous. Then there's other thing about, and I will totally leave this to Heather because she's way better explaining it than I am, but with plants, botanical medicines, in addition to not kicking up interleukins as much as a virus would, you're getting a lot of background effects, both from nanoparticles and other parts of the plant we didn't maybe even know about before immunologically, that keep it. It's more like the vitamin C story. It's like a sine wave going up and down to keep you level, as opposed to just being stimulating all the time. So I think it's really important, and they're unfortunate in my mind personally. Unfortunately, there's, I think it's only one, but one fairly large integrative medicine uh, thought tank people that released a thing that said, oh, you can't use Sambucus or these other things, and it completely ignores all of this data, and it mostly ignores this concept that yes doesn't mean yes all the time, and also what's the amplitude of increase. Totally different.
Yeah, it's like science. We can be so good at looking such one
Yeah.
narrow thing, and then we miss the whole picture.
Yeah.
And hopefully, we get to actually research elderberries on this, and I'm sure we will. 5 years from now, we will.
Yeah.
Hopefully,
I think we're going to have this long enough to research a number of things, probably, unfortunately.
another favorite,
Yeah.
actually, I'm drinking it, is lemon balm. I think lemon balm is so great because it's safe
Yeah.
for kids. I've been giving this to my kids if they're restless at night and can't go down, but
Yeah.
she also talks about this as something that people can drink during this time to just stay calm, but also it has
Yeah.
really good effects on a cytokine storm.
Yeah. Yeah, there's a lot. I mean, there's a lot of those things. Lemon balm's wonderful, and one of the things, and this kind of early on, before there was too much controversy, say around elder and some of the other things.
Yeah.
So we're here in Seattle. We're on kind of voluntary physical distancing and all of that. We're really not supposed to go anywhere except to get food or whatever, and things are pretty much closed. But in order to do that with part of our family, we've got some grandchildren living here who are between 4 and 10 years old. Little children often, it's hard to get a lot of herbs into little children because most herbs taste like dirt, and kids don't like dirt. So in past cold and flu seasons, one hit across the board is usually elder because it tastes good, it's easy to put in things, and they actually will look forward to it a bit, which is unusual for kids. Lemon balm, same way. Making, teas that the kids associate with, not medicine, but something that they like. All those things are very good, and like there's a lot of theoretical things you could give children but if they won't take it, they won't take it. So if you're trying to protect younger kids, a lot of these things are great. And I'll leave the rest of the detail to Heather, because I'm sure she'll be all over that.
Yeah.
But it is wonderful, and we do have to think about that with children. Like you
Yeah.
know, you and I will take something that we don't really like that much because we know it's good for us, but
Yeah.
child,
And it seems that kids are okay with this. I mean, I think Heather was saying that they have a high dose of melatonin compared to adults, and there's a correlation maybe with that. They
yeah,
also,
probably,
yeah,
yeah.
but I think for teas, I'm thinking licorice, rose hips are high in vitamin C. What about the mushrooms? There's a little bit of controversy on that as well, kind of like elderberries. What about, I think reishi,
Yeah.
I'm looking at Ganoderma as probably one of the best ones, or what are your?
Yeah, I mean that's kind of what I'm seeing and hearing from people. Again, I think with mushrooms, there's a lot of different mechanisms within mushrooms. One of the things that I hear with some of the mushrooms is it's real similar to the elder sambucus thing. And yes, there's some that do have a bump up in certain cytokines, but again, unless you're taking it 24/7, or you were infusing the mushroom into somebody or something, you're not going to generate that sort of a problem. Uh, Reishi, Ganoderma, those different families seem to be very good. There are mixtures that kind of are there to balance out the different mushroom effects people can take. And then the other thing that if you can during cold and flu season, and usually they're available, what we do also is we cook with a lot of mushrooms consistently, and so people are just used to it. If children don't like it, I chop them fine and hide them, and then they don't know they're eating them. Uh, but I say that because in cancer research, which is half of my world, um, what we found is that in the preventive stage, even there you go, it's in that book probably too, although Mark probably wrote the mushroom part. But anyway, um, eating mushrooms, just because people think, oh, we have to take these strong extracts and all that stuff. Just eating mushrooms on a consistent basis has been shown in certain cancers to be preventive. So the food you eat can also be part of the medicine during this time. My thoughts about mushrooms, though, are there's certain mushrooms I use that are in the families that we talked about, and I kind of use them if I feel the other things are not kind of getting me far enough, or if I see family member getting sicker. And so I'll do maybe a dose of a big extract once a day, or maybe twice a day, and you do get you get that kind of boost and your immune system gets active, but it's not like at that high level all the time like a virus would do. So what you're doing with a lot of these plant medicines is you're trying to turn a signal on to say, let's refocus immune system on the fight at hand,
Yeah.
and then it goes about regulating itself. The
Yeah.
substance is not regulating it. Same thing came up on a question on a forum yesterday about something else about um, I think it was tumor necrosis factor, and they said, well, but these natural things raise it. Well, yeah, but they raise it like at this little level. Viruses raise it at this like massive level. So
Yeah.
it'd be the same as if you were afraid of a human, right, harming you. Is a newborn baby or someone my size more likely to be able to harm you? Okay. The newborn might keep you up 24/7, not make you sleep. That's different. But physically attacking you, is a newborn baby more likely to harm you or me? Probably me. It's the same. The herb is the newborn baby, and that's what it's going to do. And
Right.
I'm a bad virus.
Yeah. Just lastly, what I'm thinking of is other viruses before this. So, for example, Epstein-Barr virus,
Yeah.
megalovirus, all these viruses that many people have dormant, herpes virus family,
Yeah.
okay? And they can damage the mitochondria, which can make us tired, right? If anyone's had mono, they remember being out
Hmm.
of school for a month or two. I hear some of my friends, they're just so fed up with being at home, and they're like, I just want to go out there. I just want to get this and get it over and done with, because I know I'm not going to die. And I guess I want to know what is your comment to that? Because what can this do in many of us who already have other viruses and this massive microbiome and fungi and viruses all living within
Yeah,
us? What happens when we add another one on top that's like
right.
this?
Yeah, and I think, and I mean, certainly we all understand understand that feeling
Yeah.
of let's just get it over. And there's actually a couple of countries that are not doing distancing for that purpose. And you know, we won't know how each strategy is going to work out till later, sadly. The thing that that I would just come back to, kind of just two things. One of them is that in in China, where they've had longer and more experience with this particular virus, when they track people who do worse, they have a rogues gallery of other infections that they already had, and things like Epstein-Barr and many things that don't give you a lot of symptoms daily, unless it's your first, like with mono, you know, your first exposure. But a lot of chronic fungi that we don't even know we have going on, and other stuff. And there's a lot of actually respiratory bacteria we can be totally asymptomatic from.
Right.
So if you put together one, two, three, four things, the bucket's already pretty full, and then you put a real nasty, you know, influenza or a COVID or something like that on top. That's the unknown. That's like, you don't know if you're going to walk into it and think you're healthy, but you're not as healthy as you thought, and you
Mhm.
get beat down. Or there are people, like there are older folks who have never had to go to the hospital and weathered it and are on the other side, and they've done fine, but they probably didn't have a bunch of other problems to start with. So what I normally caution people is because there's so many asymptomatic things that we carry and our immune system kind of keeps at bay, think of it as, you know, you're fighting on a number of fronts, but the soldiers on the other side are just, they're not bothering you,
Yeah.
but they're there.
Yeah.
If you add something that completely sucks your immune resources away from the fight, all the other soldiers now can just do whatever they want.
Yeah.
And so you're not fighting one thing, you're fighting a lot. So you do need to be careful with that. And I think, and again, we won't know till we look backwards at the data on all this, but I think the surprising, you get news reports of relatively younger people uh,
Mhm.
passing away, and people that should have been healthier. There's a lot of reasons younger people might not be as healthy as they think. And there's a lot of medication strategies that people are on to maintain autoimmunity and other diseases that are not great for the immune response. So I think we have to be careful, especially thinking, well, you know, you're a younger person. Yes, statistically more likely not to be a problem,
Yeah.
but if you got these other things going on you don't know about, maybe not so good for you.
Many of us in the US too. I mean, obesity is just, it's so high. But if an adult has allergies, for example,
Yeah,
you know,
yeah,
they are at more risk. They may not get a fever. And I think this is such a great time to utilize TCM and naturopathic
hmm,
doctors virtually, or functional medicine trained doctors, to
hmm,
treat all these underlying issues. Like with allergies, I think this is a great time to utilize
yeah,
quercetin, NAC, vitamin C, and it might actually help you. Or if you have chronic EBV and you've been diagnosed with fibromyalgia, maybe you need
yeah,
mitochondrial support right now,
yeah,
or getting
yeah,
all other things, and not just focusing on COVID-19. Because let's say you do get it, and let's say you are fine, but what's going to happen 5 years down the road, 10 years down the road? Then what? We want to
yeah,
think long term and not
yeah,
just focus on this right now. I want to thank you
yeah.
so much. I know I've taken up your lunch, and this is the 100th interview you've done this week. Is there anything else you want to add that you think is really important for people to know right now, just to help them?
Well, I think it's, thank you for people like you getting, you know, more of the word out. I think everything that we've said goes back to, beyond just basic things that you do in your life. Find a practitioner who's adept at these sort of things, as you mentioned, and work with them. And if you are in one of those, what I call the invisible at-risk groups, like chronic allergies, autoimmunity, but they're stable, you don't have symptoms, your immune system just doesn't react like the average immune system. And so something like this coming into you, you're going to have different not only different symptoms, but potentially more of an aggressive attack. So just, be thoughtful about that, and also be thoughtful of, you could feel totally fine with a lot of asymptomatic carriers, and your neighbor has one of these problems. Neighbor is chronically ill or has cancer, or grandma or whoever. So be very careful. Just be very careful around each other. But I think the other side of it is there's a lot of really good things you can do within your own power to either stay healthy or weather a disease like this better than we're seeing.
Yeah, absolutely. I think I was reading the viral shedding now from China. They're saying it could last up to 20 days, even I think
Yeah.
some cases of up to 37. So we were
Yeah.
quarantining people for 14 days and then letting them go home or go out. And
Yeah.
so many of us probably do have it, and we are asymptomatic.
Yeah.
Um, but where can people find more information on you? I know as a practitioner, I've taken many of your courses on consultdranderson.com, but on Instagram, your handle
Yeah.
is,
So some of the vitamin C things are the consultdranderson.com. We like the ISOM, we donated all of that, and so they're free on the upper on your screen, upper left side, or on your device, top of there. There's 3 different things for IV vitamin C and COVID. And then on Instagram, it's just DRA, so like Dr. A, DRA online.
yeah, I will link
Uh,
below so
all
people.
right, and then Facebook is DR period A online, and then Twitter is just Dr. or Dr. Paul Anderson. Imagine that, and then the number 1, because there's lots of Paul Anderson. So
Yeah, yeah.
Dr. Paul Anderson number 1.
Thank you so much, Dr. Paul. Thank you for all the research that you do, and hopefully we can touch base maybe in a month, because who knows, there'll probably be a lot more.
I bet we'll have more to talk about. Yeah. Yeah.
All right.
All
Have
right.
a good day. Thank you.
Thank you so much. All right. Bye.